There are new concerns tonight as another new COVID-19 variant has been detected in West Virginia. Now that brings the total number of variants here to 4. 13 News Chief Political Reporter Mark Curtis has the story.
For the first time, a case of the Brazilian strain has been confirmed in the Mountain State, according to the governor and his healthcare staff. The state now has a total of 542 variant strain cases. 3 of those are the new Brazilian variant and the South African variant. Most other cases are either the UK or California strains. The vaccines are most effective against UK, California, and South African versions, but may be slightly less effective on the Brazilian variant.
If these variants catch hold and we aren't vaccinated in the state of West Virginia, we will absolutely have a catastrophe. It will affect us economically. It will affect everything we want to do about school.
Health experts say the best way to prevent the variants is to get vaccinated. And even though the use of Johnson & Johnson vaccine was suspended, there are plenty of other doses.
We really want West Virginians to get vaccinated. We have plenty of Pfizer and Moderna available.
The variants are more infectious and more easily spread, which is why younger people are much more vulnerable.
And we know that our most strongest age group of spread is the 10 to 19-year-old young West Virginians.
As of now, anyone 16 and older can sign up to be vaccinated. There are also renewed concerns about the state's oldest residents. The governor saying today that 80,000 people over the age of 65 still have not been vaccinated. In Charleston, I'm Mark Curtis, 13 News, working for you.
And state health leaders now say that 50% of new COVID-19 cases in West Virginia are people under the age of 30.